there, meet our team. Here we have Priyanka, Kavya, Zohra, and Rajdeep. This presentation is made for St. Elsewhere Hospital Group. In this presentation, we are going to talk about clinical leadership. So, why are we talking about clinical leadership and why is it so important? Well, the answer is simple. The performance of a healthcare organization mainly depends on making a difference to the experience of patients and service users, which is in turn connected to changing the day-to-day decisions of doctors, nurses, and other clinical staff. Today, healthcare delivery is based more on teamwork rather than being an individual practice. Therefore, the need of influencing and motivating clinical leaders in a clinical practice is rising. Now you may ask, what exactly is clinical leadership and who are these clinical leaders? Well, the term clinical leadership is used when the clinical healthcare staff undertakes the leadership roles. However, the study of literature revealed that there is no standard definition of clinical leadership, although common themes do emerge, which include the ability to influence people to act and enable clinical performance, the ability to provide peers with support and motivation, the ability to play a role in representing organizations' strategic directions, the ability to challenge processes, and the ability to drive and implement the vision of delivering safe and high-quality healthcare services. Moreover, a clinical leader can be a doctor, nurse, midwife, and allied health professional. Basically, any clinician who is involved in direct patient care can be a clinical leader. Now, let's look at some of the characteristics of clinical leaders. The clinical leaders set, inspire, and promote values and vision along with utilizing their clinical experience and skills to ensure the requirements of the patient are met. Study, clinical nurse leaders were observed to be discoverers, valuers, enablers, modifiers, and shapers. There exists a lot of literature regarding the characteristics of clinical leaders, but some commonly found characteristics are that these leaders are approachable and open, they are empowered decision makers, they are visionary, clinically competent and knowledgeable, their values and beliefs are strong and evident, they possess effective communication skills, and they are looked upon as a positive clinical role models. Such clinical leaders are not identified by their job title, badge, role in healthcare services, or their position. They address any aspect of patient care and clinical service. They could be found in any clinical area. They are generally experienced and clinically focused, having a passion to develop and improve current practices. They use their expert clinical knowledge for initiation and promotion of change to develop high quality care. Moreover, being a good clinical leader clearly requires a different set of skills from being a good clinician. Hence, it is important to develop and nurture clinical leaders. An organization should support and train their leaders for high-level skills required for their jobs. These skills include leading and developing multidisciplinary teams, understanding organizational systems, processes, and interdependencies, redesigning services and working collaboratively with a wide range of stakeholders. It is found that Individuals who participate in leadership trainings are more likely to feel empowered to influence the provision of patient centered care, develop a great sense of self awareness and confidence to initiate positive change, and promote better team alignment. Few things essential to develop and nurture clinical leaders in any organizations are establishing a clear vision of future clinical leadership development needs, evaluating and acknowledging individuals that demonstrate commitment towards clinical leadership, and conducting structured clinical leadership trainings that allow ease of transition. To achieve these goals, numerous approaches has been identified. One such approach is to encourage leaders to develop their capacities to make them and their organization more effective. Another approach is to provide a platform for all the individuals of an organization to increase their skills by offering role models, resources, and opportunities. However, interprofessional and organizational level barriers exist in developing clinical leaders. Therefore, the development of clinical leaders should also involve both boundary building and boundary spanning opportunities, such that the leaders gain experience to articulate a distinctive disciplinary perspective and engage with it for the success of the organization. Moreover, leadership development programs should be based on some key points like engaging leaders in systems thinking, team leadership, conflict resolution, and negotiation. Intellectual or higher order cognitive skills, such as complex reasoning and verbal skills, can be transferred by spaced learning, which involves a concept of repeated practice. Another such approach is error learning, which involves identifying and rectifying mistakes made by fellow people, oneself, or from field relevant case examples. Furthermore, approaches like educational sessions, self-reflection, small group discussion, coaching, and networking opportunities can also be used in the development of clinical leaders. Similarly, a study done by Day in 2001 acknowledged 6 more ways of developing clinical leaders, which are 360-degree feedback, executive coaching, mentoring, networking, job assignments, and action learning. However, for this particular organization, we would consider informal mentoring as it may prove to be more beneficial than formal mentoring. This is because clinical leaders are already present here, but they need to be developed into an effective and effective clinical leaders. In addition to this, post-training practice in real-world situation would prove to be another beneficial way to develop and nurture key skills required to be a good clinical leader. For a successful functioning of an organization, a clinical leader should be both effective as well as effective. To enable effective and effective practice by a clinical leader, it is important for an organization to create a right environment. Through a flow of sound performance information, effective practice can be enabled. The healthcare organization should clearly define what they expect from their clinical leaders and what skills and attitude they wish to encourage within them. Furthermore, effective and effective practice can be enabled by influencing, recognizing, rewarding, and empowering the existing leaders through effective communication to learn and share the information, inculcating values and beliefs on proper governance. Principles like transparency, honesty, openness, and integrity is essential. Clinical leaders should be confident and capable with the meaning and content of these governance principles. According to a study, clinical governance is described as a robust framework that recognizes the importance of adopting a culture of shared accountability, for sustaining and improving the quality of services and outcomes for both patient and staff. Thus, clinical governance is essential to enable effective and effective practice by clinical leaders. However, the challenge faced by all clinical leaders is to recognize and respond when change and improvements are required, as well as to adopt a people centered approach to encourage, engage, power, enable, and enlighten team members, patients, and their carers to involve in the change and evaluation process. Therefore, a clinical leader should possess these qualities along with a complete knowledge and understanding of the values, vision, beliefs of their organization. Developing these traits associated with the requirements to improve and maintain quality helps in the successful accomplishment of effective and effective practice by the clinical leaders. Now, let's answer some of your frequently asked questions. Why should we consider clinical leadership at every level of organization? The answer is slowly but steadily, while climbing the ladder of their career, every clinician has to take up leadership roles in their lives. Many clinicians have moved towards management and administrative positions with each promotion. Therefore, enabling clinical leadership at every level of organization would ensure personal as well as organizational benefit. So, what are the hurdles to the development of clinical leaders? Well, the answer is training. A senior clinician in the organization would not like to undergo the training process. Even though the suggested training is informal type, they would feel inferior if they had to learn clinical leadership from their fellow peers. Second hurdle being practical implication. Practical implication of clinical leadership needs to be monitored by the leaders themselves. Without proper knowledge of clinical leadership, the practical implication will not produce desired outcomes. Moreover, learning from peers can be another hurdle, since the essence of sophistication and inferiority complex usually disables this process. Moreover, clinicians are autonomous, which restrains them from learning through peers. Lastly, what is the difference between a clinical leader and a leader of commercial organization? Unlike other leaders in any commercial organization, the focus of a clinical leader is not profit, but patient care. The organization's strategic decisions are made collaboratively with other stakeholders and not by a single person. Hence, it requires bigger partnership skills for such collaboration as compared to other commercial leaders.